Let's grab our anti-burst ball, placing it under your head, coming into a supine figure 4 stretch. Reach your tailbone away from you, creating low back extension. Dorsiflex the foot that's crossing over the knee. Use your elbow, the same elbow as the leg that's crossed over, to press that thigh open as you pull the hamstring towards you of the leg that's on the bottom. Continue to reach the tailbone away from you. And now connect with your breath. Inhale through the nose. Pull your belly button in towards your spine, bracing the abdominals. Exhale the air out the mouth. Again, keeping the tailbone reaching away, pressing the back ribs into the floor to keep the rib cage closed. Pull the navel in, brace the abs, and fog of air with your exhale. Go ahead and switch sides. We're opening up the outer hip, the glute med, piriformis area. Setting up, dorsiflex the foot. Use your elbow to leverage and open that thigh. Pull the hamstring towards you without lifting the pelvis up and rounding. Reach the tailbone towards the bottom of the mat. And now let's focus on contracting the transverse abdominis. To do this, we inhale through the nose, pull the navel in towards the spine, tug up on the muscles that stop your stream of pee, and hold that tug as you exhale the air out the mouth. Inhale through the nose, pull the belly button in, brace the abs as if you're going to be punched in the gut, and fog of air with that exhale. Contracting your transverse abdominis conditions the deepest layer of the core, and this can alleviate chronic back pain. From here, we're going to take the ball and we'll place it under the sacrum, elevating our pelvis. The ball needs to be high enough that when you place your pointer fingers on the bony protrusions of your hips, your ASIS, you can guide them down and the butt can drop off the roller a bit towards the floor, creating a lot of lumbar extension, and then we'll tilt the pelvis back to neutral and to extension. Every time the pelvis goes down towards extension, we exhale. Every time it comes back up to neutral, we inhale. Exhale down, inhale neutral. Moving only on the breath, lifting in and up on the muscles that stop your stream of pee, bracing the abs every time you take the pelvis to extension. And inhaling, resetting, breathing laterally into the rib cage. Pull the navel in, brace those abs, keep the back ribs imprinted on the floor, and tip down. Moving on your breath with the awareness of the core staying braced on the exhales, the sternum melting in towards the spine, the shoulders plug down the back, the collarbone wide. So if you notice yourself pushing your ribs forward, this is going to make it hard to access the core. So keep the ribs reaching towards the back body and the belly button pulling in towards the spine. One more breath here. Inhale, pull the abs in, brace them. Lift in and up on those muscles that stop your stream of pee, and fog a mirror with your exhale. Placing the hands right by your side, nice and heavy, palms down, wrists heavy. Float one leg up to butterfly. Keeping the other foot on the ground, the bone of the big toe heavy. We're going to lower and lift the leg, inhaling to lower, bracing the abs, exhaling to lift. Make sure you're not turning that leg out from the knee, but from the top of the hip socket, lowering and lifting on the breath. Remembering we always want to brace the abs to bring the leg back up and keep the tailbone reaching away so that we have some lumbar extension. Countering the typical position of the pelvis, which is flexion tucked under. Moving on the breath, give me 2 more. Inhale to lower, brace the abs. Hear your breath as you exhale to lift. 1 more, inhale, lower. Bracing the abs, fog a mirror with that exhale. And moving to the other side, setting up. Remember, the foot that's down, you should have weight in the bone of the big toe. There's a tendency to roll out on the foot. Supinating, bow-leggedness is what we see with sway back posture. We're going to balance the feet and ankles so that the legs are working efficiently. Should be lowering and lifting on the other side, trying to not wag the tail or move the pelvis too much. Just guide the tailbone away from you, keeping that lumbar extension. Guide the sternum in towards the spine, closing the front ribs, plugging the shoulders down the back. Check in with your breath. Inhaling through the nose, drawing the navel in towards the spine, lifting up on those muscles that stop your stream of pee, and fogging a mirror with your exhale. One last time, inhale, prepare. Brace the abs, and exhale to lift the leg back up. We're going to slowly bring both legs down, lifting the pelvis up to slide the ball out and place it between the knees. Opening the arms out to a T, imprinting them, making sure that the palms are up and the wrists are slightly below the shoulders. Nod your chin down, engaging the front of the neck muscles. Reach the tailbone away, creating lumbar extension. Exhale, float the legs up to tabletop. Knees should be tracking in line with the hips. Make sure that the knees are not slightly forward. This is going to make the work easier on the abs. We want to really work the lower abs here. So we'll move on the breath, inhaling to twist, turning the head away from the knees as they drop to one side, bracing the abdominals, and exhale, lifting the legs back up to center. Reach the tailbone towards the bottom of the mat for the duration of the exhale, bracing the abs each time you lift the legs back to center. Check in with your rib cage. Try to keep the sternum melting in, the collarbone wide, the shoulders plugged down the back. Turn the head away. You'll get a nice neck stretch as you're working. Hear that exhale. It's important that we use our breath. Inhale to prepare, exhale on the effort. Remember that. Inhale to prepare, exhale on the effort. And why are we exhaling on the effort? We're exhaling on the effort because that's when we are pulling our navel in towards our spine and lifting up on the muscles that stop our stream of pee. These two actions, when you sustain them, contract the transverse abdominis. And as I said, that's the deepest layer of your core. Conditioning this area alleviates low back pain. Make sure that when your sternum reaches towards your back body, you don't round the front of the shoulders. So there's a fine line between puddling the heart in and allowing the shoulders to round inward. So you have to isolate. Move the sternum towards the back body, but still plug the shoulders down the back and keep the collarbone wide. From here, we're going to take the ball and set it to the side, and we'll grab our foam roller, moving it under our upper shoulder blades, supporting our head. Our feet are hip distance apart, on the ground with the knees pointing up to the ceiling. We're going to take a rectus abdominis stretch, opening up the upper fibers of the top abs and internal obliques where you're tight. So we'll let gravity do the work as we slowly extend the upper back, supporting the head at all times, trying to open the elbows out and keep the shoulders pressed down and not elevating towards the ears. Inhale here, pull the abs in, brace them, and exhale that air out, sinking deeper into this upper back extension. Inhale, pull the abs in, brace them, exhale, allowing yourself to stretch further. So gravity does the work here. Some checkpoints to think about are the feet that are on the ground. Where is the pressure? Are you rolling out on the feet, or is there some pressure in the bones of the big toes? The tailbone. Is your pelvis tucked under, putting pressure on the low back? Or are you reaching the tailbone towards the feet, extending the lumbar to create more space? Obviously, since we're arching back, the ribs are going to spray forward. See if you can actually press your shoulder blades into the roller, trying to combat that. This is going to intensify the stretch of the upper abdominal wall. One more breath here. Inhale through the nose, draw the belly button in towards the spine, brace the abs, Fog a mirror with your exhale. Good work. We're going to grab our lightest Theraband, set it to the side, and we'll grab our foam roller and come to lie on our stomach. We'll place the forearms on the foam roller, and we're working on upper back extension. We'll do a 2-breath hold at the top. Make sure the bony protrusions of the hips are anchored to the floor, the belly button's pulled in towards the spine. You don't want excessive pressure on the low back, so really brace your abs as you lift up. And we'll pause here, inhaling through the nose, pulling the abs in, bracing, and exhaling. Inhale through the nose, pull the abs in, brace, and exhale. 2 more. Inhale, abs in, brace, exhale. And 1 more. Inhale, abs in, brace, exhale. We'll lower down slowly on our next exhale with the abs bracing. Now I'd like to move in and out of this position. No longer doing an isometric hold at the top. So inhale, prepare, exhale to lift up. Inhale, and exhale, lowering back down. Notice we're moving up and down on our exhales. Pausing at the bottom and the top to inhale laterally into the rib cage. Pulling the navel in towards the spine, bracing the abs to control the descent and to control the lift. This is great for your upper back extensors to combat the kyphosis due to the overactivity of the rectus abdominis and the internal obliques upper fibers. Again, inhale at the bottom, brace the abs, fog a mirror with your exhale as you lift up. Pause at the top, breathing into the shoulder blades and the side body like an opera singer. Pulling the abdominal wall in and bracing the abs as if you're going to be punched in the gut. Hear your breath as you lower yourself down with control. 1 more. Inhale through the nose. Brace the abs. Exhale, lift. Inhale, prepare to brace and control your lowering. We're going to come onto all fours. Knees will be on the roller with the toes down on the floor. Your lightest Theraband will be pinned under one hand. And we'll extend the opposite leg as the hand holding the band in the air. If this feels like too much, you can keep the toes down of the leg that's extended. If you'd like to hold it up in the air, let's send energy through the leg and flex the foot the entire time. The arm will lower and lift on a 3 count, taking it up, 2, 3, exhale, inhale, lower, 2, 3. Exhale to lift, 2, 3, inhale to lower, 2, 3. Make sure your shoulder is plugged down your back. You're keeping that sternum reaching towards the back body. Your tailbone's reaching up on the diagonal, so you have lumbar extension. Keep going with those lower and lifts, working the back of the shoulder. Breathing, lifting, 2, 3, and lowering, 2, 3. Notice if there's wobbling happening in the pelvis. Stay square. Those bony protrusions on your hips should shine like headlights towards the floor. And stay even. No hiking one hip higher than the other. The leg that's extended, the foot should be dorsiflexed. Let's go ahead and set up to do the second side. Palm of the arm extending, faces in towards the face. Fingers are long. The arm that is supported the movement, make sure the elbow is slightly bent and that your shoulder is right under your wrist, or your wrist rather is right under your shoulder, and that your knees are tracking right under your hips. As you're doing this movement, be aware of your breath. We want the breath to support the movement. So the effort is extending that arm out. When we lower, gravity helps us. So on the effort, we exhale, bracing the abs, and then we lower down. 2 more. Brace the abs to lift. Inhale to lower. Brace the abs to lift. Inhale to lower. We're going to pin the lightest Theraband under the roller, tying it into a knot on one end of the roller. Let's tie it on the non-dominant arm side, so we do our harder side first. We'll bring the knees on the roller, the ball between the knees, and we'll move into lateral flexion with a 2-breath isometric hold. So once you side bend, you'll add your bottom arm, increasing the load on the external obliques, holding it here. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale back to starting position. Brace the abs. Exhale, side bending, adding the bottom arm. Palms facing in, sternum reaching towards the back body, tailbone back, inner thighs engaged. 1 more breath here. Shoulders plugged down the back, chin retracted or turned to the side if the neck is straining. And back up. Doing great. Keep that going. Taking it to the side, bracing the abs, adding the bottom arm as the long lever, increasing the load on your external obliques and your QL. Hold for 1 more breath. Sternum reaching towards the back ribs, belly button pulling in towards the spine. Brace those abs to bring you back up. And we'll switch sides so you can turn your roller around, bring the knees back on it, toes tucked under, side bending to the other side. Adding that bottom arm, checking in with your breath, your abs, your inner thighs, your tailbone, little lumbar extension, shoulder blade retraction, shoulders down the back, collarbone wide, sternum reaching in towards the back body. Hear those exhales. Come back up after you do 2 breaths, doing as many repetitions as you can do with control and awareness. 10 more seconds here, using your breath, squeezing the ball, engaging the lower abdominals to support the movement. From here, we'll grab a 3-pound weight, and we're going to come to lie prone on our mat with the weight in your non-dominant arm and your dominant hand, the knuckles on the forehead, elbow out to the side. Take a moment to anchor your bony protrusions of your hips into the floor so that the pelvis is stable. Pull the abs in towards the spine, brace them and lift up, pumping the arm by your hip. Inhale, 2, 3, 4. Exhale, 2, 3, 4. 1 more, 2, 3, 4. Exhale, 2, 3, 4, and lower down. Again, lifting up, bracing the abs, pumping the arm by the hip with the palm facing in towards the thigh. Make sure that the movement is up an inch, down an inch, the shoulders plug down the back. The abs are remaining braced, and lower back down. We've got 2 more sets on this side. Lifting up when you're ready, bracing the abs to do so, and pulsing that arm right by the hip. Small movement, engaging the tricep. Breathing in, pulsing. Try to keep the shoulder blades together and retracted, collarbone wide, sternum reaching towards the back body, hip bones, bony protrusions of the hips heavy on the floor, anchoring that pelvis, and lower down. We'll pass the weight to the other side, switching, repeating on the other side. When you're ready, inhale, prepare, exhale, brace and lift, and pulse. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4, and hold. Inhale, brace the abs, and lower yourself back down. Let's repeat that. Thinking about your checkpoints here, continue working. Remembering you're doing 2 full breaths of pulses at the top. If your neck is straining, retract your chin. Take your eye focus about 1.5 feet in front of you. Plug your shoulders down your back. If you feel a lot of pressure in the low back, pull the belly button in and lift up on those muscles that stop your stream of pee. You can always come back to that pelvic floor lift to support the low back as long as the belly button is pulled in. Finish up your last set, and when you're ready, lower yourself back down. Great work. We'll grab our lightest loop band, setting it to the side, and we'll grab our anti-burst ball to place under our pelvis to elevate our hips up. Take your pointer fingers to the bony protrusions of your hips and guide them down for some lumbar extension. With one hand, take one shin in towards your chest and extend the other leg out long. You'll want one hand on the ground for stability. The goal here is just to release the hip flexors before we work them strength-wise. They're not a posturally tight muscle, but due to how we sit, frequently they do get tight. Breathe here, squeezing the front of the extended leg's thigh. One more inhale and exhale, and then I'd like you to switch sides. Setting up, making sure you have pelvic stability as you extend that leg out long. You can point the toes, reaching through the foot as well. Make sure the foot is on the ground. It's not lifted in the air, because that'll make it a strength exercise. This is all about releasing your hip flexors. So breathe in through the nose, pull the abs in, squeeze the front of the extended leg's thigh, lengthen that leg away from you. The heel should have contact with the floor. So should one of your arms, so that you're not wobbling back and forth. One more breath here. And after that breath, place both feet on the ground. Lift the hips up into the air, pressing through the bones of your big toes, squeezing the abdominal wall, reaching the tailbone towards the toes. Slide that ball out and lower your back from the upper back, mid back to tailbone, back to the floor. Come up to sit. Grab your lightest loop band and place it around the arches of the feet. Lie back down on your back. Elevate the pelvis again by placing the anti-burst ball under your sacrum. Find that lumbar extension. Guide the bony protrusions of your hips down, creating extension. And then anchor your arms at your side, pressing them heavy into the floor. Let's lift your non-dominant leg up first. Dorsiflexing the foot, and we lower on our inhale, lift up on your exhale. 2, 3. Inhale, lower. 2, 3. Press through the bone of the big toe of your supporting foot. Reach the tailbone towards the bottom of your mat, towards your toes. Keep the lumbar extension, keep the sternum reaching towards the back ribs, the shoulders down the back of the neck long. Focusing on a nice dorsiflexed foot, keeping the knee tracking right over the hip, not in front. Creating a right angle. The shin, once the leg is up, should be parallel to the floor. Give me 2 more. Lifting on a 3 count, exhaling, bracing the abs to lift, inhaling to lower, bracing the abs to lift, and inhaling to lower. Setting up on your dominant leg side, dorsiflexing the foot, and beginning when you're ready. Make sure the foot that's staying down the bone of the big toe is heavy, as if you have a quarter under it and you're trying to squash the quarter with the bone of your big toe. It's going to be really important that you remember this image and that you use this when we come to standing for lunges and squats. This will help your knee track better and help you not supinate as much. So I know you're breathing, using the breath to support the movement. The exhale on the effort as we lift the leg up. Inhaling to lower, tailbone reaching away from you, sternum reaching in towards the back body. One more here. Lifting on our exhale, lowering on our inhale. And you can kick that band away, lift the pelvis up. Take the ball out from underneath and peel the vertebra back to the floor, imprinting it into the floor, guiding the tailbone away, walking the feet in towards the buttocks, and placing the ball between the inner thighs. Hands down by your side, imprinting your arm extensors, the back of the arms, triceps, wrist, hands. Exhale, reaching the tailbone away from you to lift the pelvis into the air, squeezing in on the ball. Hold it here. Inhale 1, breathe. Exhale 1. Peeling down upper back, mid back to tailbone, pausing at the bottom to inhale. Brace the abs. And exhale, pick the pelvis up, pressing heavy into the bones of the big toes. Hold it at the top. Inhale 1, breathe. Exhale 1. And peeling down, sternum reaching towards the spine, slowly articulating that spine. Tailbone is last. Inhale, prepare. Exhale, brace the abs, lift the pelvis into the air, press heavy into the bones of the big toes. Hold it here. Inhale 1, breathe. Exhale 1. Peeling down, sternum reaching towards the spine, vertebra by vertebra. Next time you come up, I'd like you to stay up, heavy the bone of your right toe, and extend your left shin. Hold it here. Inhale 1, breathe. Exhale 1. And inhale, lower that left shin down, switching sides. Heavying the bone of the left big toe, extending your right shin. Holding. Inhale 1, breathe. Exhale 1. And inhale to lower that shin. Continue alternating. We call this marching. Pelvis should be staying at the same height. You should be moving on your exhale to lift that leg up, pausing for a full inhale and a full exhale, and lowering on your next inhale. Keep those hips high. Tailbone reaching away from you down towards the bottom of the mat, sternum puddling in, collarbone wide, shoulders down the back. And finish your last one and articulate the spine as you melt down, vertebra by vertebra, bringing your tailbone to the floor. We'll grab our foam roller and we'll place our feet on it with the ball still between the knees, making sure the roller isn't too far away from the buttocks. Try to get it as close as you can without aggravating the knees. Then you'll wrap your feet around the roller like a bird does around a limb of a tree. I want you to really press into the bones of your big toes, even though the roller is around the arch of the foot. Hands are heavy at your side, and we're going to just lift the pelvis up, squeezing in on the ball as we brace the abs, and then we'll articulate the spine as we lower back down to the floor. Brace the abs and lift the pelvis up. Hold it up. Inhale 1, breathe. Exhale 1. Inhale, and brace the abs, peeling down upper back, mid back to tailbone. Continuing, the goal here, continue as I'm speaking, is to brace your abs and not have the roller moving forward or back. It's to stabilize the roller using your abs, using your glutes, using your feet. So feel the bones of your big toes as you wrap your feet like a bird around a tree limb. Really brace that roller, trying to stabilize it. On your next lift up, I want you to stay up, and we're going to try our marching here. If the marching feels like too much for you today, I'd like you to hold an isometric hold, keeping the pelvis up as we march. We're going to extend one shin, pressing heavy into the bone of the opposite toe, the toe that's staying down, keeping the hips even and elevated. Holding for a full inhale and exhale, and then lowering on your next inhale to switch sides. We don't want the hips shifting side to side or dropping, one staying higher than the other. They should stay at the same height as we extend the shin. We're working to balance out and strengthen the glute max and glute min. Make sure your pelvis is up. You're breathing in through your nose, bracing those abs before you extend the leg. You inhale, prepare, you brace the abs again. You inhale, and you control the descent of that shin as it comes down. Let's do one more. Using the breath, lifting up on those muscles that stop your stream of pee, holding that lift as you fog a mirror with your exhale. Inhale again, brace the abs, Fog of mirrors, we lower that shin down and bring the upper body, mid-back to tailbone down, sliding the roller to the side, coming up to sit. Great work.